So we will discuss the heart. So in this chapter, we will discuss the function of the heart, ano yung anatomy ng heart, which is we are going to know the size and where the heart is located, ano yung nakakover sa heart, ano yung mga walls ng heart, ano yung 4 na chambers ng heart, ano yung mga valves ng heart, at ano yung mga coronary blood vessels ng heart, ano yung heart sounds, ano yung sound ng heart, yung abnormal at normal sound, yung pathway ng blood through the heart, paano pumapasok at umaalis or lumalabas ang blood sa heart, yung cardiac cycle, yung cardiac conduction pathway which includes the conducting system of the heart, at yung electrocardiogram or ECG. I think this is electrocardiogram. And we are also going to discuss yung heart rate, yung abnormal and normal heart rate, how can we regulate our heart rate, yung cardiac output, at yung disorders, some disorders related to the heart. So yun, these are the learning outcomes. So what is the function of the heart? So the heart pumps blood. So this is the heart, and it pumps blood, which creates blood pressure, and that pump of the blood creates the blood pressure and circulates oxygen, nutrients, and other substances. So the heart, the oxygenated blood enters the heart as the oxygenated blood, or the blood enters the heart as the oxygenated blood, and the heart will pump that blood into to the lungs, and then for it to become oxygenated blood, and then yung oxygenated blood babalik dito sa heart, babalik sa heart, and then the heart will pump it again papuntang aorta and to the other parts of the body to circulate the oxygen, some nutrients, and other substances. So what is the anatomy of the heart? The heart is about the size of a clenched fist or suntok. So it is located obliquely within the mediastinum of the thoracic cavity. So this is the thoracic cavity. The heart is located sa mediastinum niya, which is from the word itself, middle, sa gitna ng thoracic cavity. So this is the anterior view of the thoracic cavity, which includes the heart is in the middle or middle of mediastinum of the thoracic cavity. This is the heart. Ito yung right lung, ito yung left lung, ito yung diaphragm. So ito yung apex ng heart, yung pinakababa ng heart. Yun. Ito yung borders, superior border and inferior border. Ito yung superior vena cava. Dito sa baba yung inferior vena cava pero hindi nakikita. So ito yung another anterior view of the heart. So ito dito yung heart. This is the thoracic cavity pala. Anterior view of the thoracic cavity. So dito ang heart, dito yung diaphragm. Ito yung right lung, ito yung left lung, dito yung arc of the aorta, dito yung pulmonary trunk, ito yung superior vena cava. So what covers the heart? The coverings of the heart, we have yung the outer, yung sa labas, the fibrous pericardium. It is made of fibrous connective tissue that surrounds the heart and extends over the diaphragm and the bases of the great vessels. So this is the fibrous pericardium. This is the outer covering of the heart. It is made of fibrous connective tissue. This surrounds the heart. This color dirty white or something yellow. This is the fibrous pericardium. It is made of fibrous connective tissue that surrounds the heart. Ito, that surrounds the heart. You also have the parietal pericardium. Ito, the parietal pericardium is a serous membrane that lines the fibrous pericardium. So this parietal pericardium lines the fibrous pericardium sa loob. It is made of serous membrane. So we also have the visceral pericardium or the epicardium or the epicardium. It is a serous membrane on the surface of the myocardium. This is the myocardium. This muscle here is the myocardium. So the visceral pericardium or the epicardium pericardium is on the surface of this myocardium. Ito. This is the epicardium or the visceral pericardium. And between the visceral pericardium and the parietal pericardium is the pericardial cavity where there is a serous fluid. May fluid dito sa gitna ng visceral pericardium and parietal pericardium. Dito sa pericardial cavity, itong blue. So, this serous fluid prevents friction as the heart contracts. So, this fluid prevents friction sa heart pag nagbi-beat siya or nagko-contract. So ito, these are the coverings of the heart. We have the pericardium, we have the epicardium, the myocardium, and the endocardium. So this is the outer layer of the heart. Ito, pericardium. And then the epicardium is on the surface of the myocardium. And sa itong endocardium is the inner covering of the heart. Ito. So this is the pericardium. It is made up of fibrous connective tissue. As you can see, it is parang fibers of connective tissue. And then this is the epicardium or the visceral pericardium ito. And between the visceral pericardium and the pericardium is the pericardial cavity where there is a serous fluid that prevents friction. Ito yung myocardium. Itong malaking portion. This is the myocardium and this is the endocardium, which is the inner covering of the heart. So ito, the layers of the heart wall, we have 3. The epicardium, myocardium, and the endocardium. As you can see dito sa this is the heart wall which includes the epicardium, myocardium, and the endocardium. Hindi na belong yung pericardium. So the wall of the heart has 3 layers. The outer, yung sa labas, this one is the epicardium. It is a visceral layer of the serous pericardium. And then we have the middle, which is itong sa gitna, the myocardium. It is the middle layer of the heart. And it is reinforced by a fibrous skeleton. And the inner layer of the heart wall is the endocardium, this one. So the endocardium is the inner layer, and the myocardium is the middle layer, and then the epicardium is the outer layer. So this is the external and internal structure of the heart. Ito yung external, sa labas na structure ng heart, at ito yung internal structure ng heart. We have the superior vena cava, inferior vena cava, dito banda yung right atrium, dito banda yung right ventricle, dito banda yung left ventricle, the right atrium. This is the aorta, the ascending aorta. We have ito yung aortic arc, parang arc, and this is the pulmonary artery. Ito yung left pulmonary artery, ito yung right pulmonary artery, ito yung pulmonary vein, right pulmonary veins, left pulmonary veins. Ito naman yung sa internal structures ng heart. Ito yung inferior vena cava. Ito yung superior vena cava. This is the right atrium. This is the right ventricle, and between the right atrium and the right ventricle is a valve called tricuspid valve. This is the tricuspid valve, and this is the pulmonary artery, left pulmonary artery, the right pulmonary artery, and between we have the pulmonary valve, and this is the left ventricle. This is the left atrium. These are the left pulmonary veins. So this is the bicuspid valve. Dito sa right side is the tricuspid valve, and dito naman sa gitna ng left atrium at left ventricle is the bicuspid valve or the mitral valve. So what are the chambers of the heart? The heart has 4 chambers. We have the 2 superior chambers are the atria, and 2 inferior chambers are the ventricles. So if you're going to divide the heart into 4, the upper or the 2 superior chambers are the atria, this one, the right atrium and the left atrium, and the two inferior chambers are the ventricle, the right ventricle and left ventricle. So we have the right atrium receives blood from the three veins, the superior vena cava, inferior vena cava, and coronary artery. This is the right atrium. So the right atrium, it receives blood from the three veins. We have the superior vena cava, the inferior vena cava, and the coronary sinus, pero wala dito yung coronary sinus. So these veins is where kung saan nagpapas ang deoxygenated blood, and that blood flows into the right atrium dito. That's why the right atrium receives blood but deoxygenated blood or oxygen poor blood. Dito naman sa left atrium, the left atrium receives blood from the lungs. So, etong right atrium, it receives blood from the three veins from the body, three veins. Tapos ditong left atrium naman, it receives blood from the lungs. So the blood that was in the lungs becomes oxygenated, and then yung blood na yung oxygenated blood na yon papasok dito sa pulmonary vein, the left pulmonary vein and the right pulmonary vein papuntang left atrium dito. So the left atrium also receives blood from the lungs through the four pulmonary veins dito. The left and right pulmonary veins. The difference between the right atrium and the left atrium is that the right atrium receives the oxygenated blood or oxygen poor blood. Dito naman sa left atrium, it receives oxygenated blood or oxygen rich blood. So, the right and left atria are the upper chambers, yes. This is the upper chamber, the right atrium and the left atrium. So, they are separated by interatrial septum. Between them is the interatrial septum. Sa gitna nila, ang nagseseparate sa right and left atria is the interatrial septum. So, the walls of the atria produce an atrial natriuretic peptide or ANP when BP is increased. So, pag lumalaki ang BP ng isang tao, ang atria, which is the right atrium and the left atrium, will produce atrial natriuretic peptide or ANP, and this ANP will increases the loss of Na ions or sodium ions and water sa urine natin. And this increase in the loss of Na ions and water ions sa urine will decrease blood volume. So, it will also decrease the blood pressure when the BP is increased, and thus the BP becomes normal. So these are the structures of the heart. Ito, superior vena cava, inferior vena cava, this is descending aorta. Ito yung ascending aorta. Ito yung aortic arc of aorta. Ito yung brachiocephalic trunk. Ito yung left common carotid artery, the left subclavian artery. Dito banda yung right atrium, dito banda yung right ventricle, dito banda yung left ventricle, and dito banda yung left atrium. So ito yung sa loob na structure ng heart natin. Ito yung right atrium, ito yung right ventricle. Dito sa gitna nila is the tricuspid valve. This is a valve. Itong puti, that is a valve. And then we have the pulmonary trunk, left pulmonary artery, right pulmonary artery. Itong pulmonary arteries ay papuntang lungs yan, left and right lungs. You also have the pulmonary valve. Ito, this opens and closes. And we have the left ventricle, the left atrium. Between the left atrium and the left ventricle is the bicuspid valve, this one here. On the right side there is a tricuspid valve, on the left side we have the bicuspid or the mitral valve. So we also have the ventricles. You have the right ventricle and the left ventricle. So the right ventricle, this one, and the left ventricle, this one. So the right ventricle pumps blood to the lungs through the pulmonary artery. So, ang nagpapump talaga sa heart natin is the ventricles. You have the right ventricle and the left ventricle. So, when the blood na nandito sa right atrium flows into the right right ventricle, the right ventricle pag nagpump ang pag etong ventricle, the blood that was accumulated here will be pushed dito sa pulmonary artery. Ito, we have the left pulmonary artery and the right pulmonary artery papuntang lungs yan. Papuntang right lung and papuntang left lung. So yon, the right ventricle, this ventricle here pumps blood papuntang lungs through the pulmonary artery. And similar function na ng left ventricle. The right ventricle and the left ventricle has the similar function pero different yung destination yung pinapump nila na blood. So, dito sa left ventricle, it pumps blood, pinapump niya yung blood papuntang aorta. Itong aorta. Ito. So, the left ventricle will pump the blood papuntang aorta and then the aorta will distribute the oxygenated blood all throughout the body. I forgot. Wait. Here. So, I forgot to differentiate the right atrium and the left atrium. So, the difference between the right atrium and the left atrium is that the right atrium receives deoxygenated blood or oxygen-poor blood, while the left atrium receives oxygenated blood or oxygen-rich blood. So we also have the same difference between the right ventricle and the left ventricle. So the right ventricle pumps the oxygenated blood and the left ventricle pumps oxygenated blood. So we have the right and left ventricles are the lower chambers. So they are the lower chambers. They are separated by interventricular septum. This one here is the interventricular septum. It is what separates the right and left ventricles. Kung kanina, ang nagseseparate sa atria, the right and left atrium is the interatrial septum. Dito sa ventricles, you have the interventricular septum. So in the right and left ventricles, the papillary muscles and chordae tendineae prevent inversion of the left AV valve when the left ventricle contracts. So meron tayong papillary muscle, this is the papillary muscle and the chordae tendineae. So this papillary muscle and chordae tendineae, pag nag-contract itong left ventricle, this papillary muscle and the chordae tendineae will prevent the inversion of the bicuspid valve or the AV valve. Yon, it prevents the inversion of the left AV valve, itong bicuspid valve when the left ventricle contracts. So ito yung anterior view of the heart, partially sectioned heart. Ito yung right atrium, dito banda yung left atrium, ito yung right ventricle, dito yung left ventricle. So paulit-ulit lang. So we also have the heart valves. We have the atrioventricular valves and the semilunar valves. So in the atrioventricular valves or the AV valves, you have the right AV valve and the left AV valve. The right AV valve is also known as the tricuspid valve. This is the tricuspid valve. So the function of these valves, the tricuspid and the mitral or the bicuspid valve, they prevent backflow of the heart. Backflow means backflow of blood. Pagbalik ng blood from the dito sa tricuspid valve, this prevents backflow of blood from the right ventricle papuntang right atrium. Kasi 'di ba, when the heart relaxes, the blood that was accumulated here in the right atrium will flow into the right ventricle. And then pag nag-contract itong right ventricle, the tricuspid valve will close para ma-prevent yung backflow ng blood na na-accumulate dito sa right ventricle papuntang right atrium. Kasi 'di ba right atrium to the right ventricle, then dito sa pulmonary artery. So to prevent the backflow, nagko-close itong tricuspid valve. So the same function din ang bicuspid valve or the mitral valve. Piniprevent niya yung backflow ng blood from the left ventricle sa left atrium. So, di ba, ang blood, oxygenated blood that was accumulated here in the left atrium, pag nag-relax ang heart, mag-flow yung oxygenated blood papunta dito sa left ventricle. So, pag nag-contract itong ventricle, magka-close itong mitral valve or the bicuspid valve para ma-prevent yung pagbalik ng blood papuntang left atrium. So, we have the semilunar valves. Itong pulmonary semilunar valve and the aortic semilunar valve. So, lahat ng valve na ito, they prevent backflow. So, the pulmonary valve, pulmonary valve, this also prevents backflow of blood from the pulmonary artery to the right ventricle when the right ventricle relaxes. So, di ba, magko-contract itong right ventricle para yung blood na nandito is ma-push papuntang pulmonary artery papuntang lungs. So, pag nag-relax ang heart, itong pulmonary valve, magka-close yan para mag-prevent ang pagbalik ng blood from the pulmonary artery to the right ventricle. So, ganun din ang function nitong aortic valve or the aortic semilunar valve. So, pag yung blood na na-accumulate dito sa left ventricle, pag nag-contract ang left ventricle, mapupush ang blood, oxygenated blood na yon, papuntang aorta, and then the aorta will distribute it to the other parts of the body. So, pag nag-relax ang heart, yung blood na nandito na sa aorta, hindi na makakabalik dahil nag-close na itong aortic valve. So, the aortic valve prevents the backflow of the blood from the aorta pabalik sa left ventricle. So, this is the ito yung bicuspid valve. Ito, dito banda. Ito yung bicuspid valve. Pag open siya, pag yung blood nag-flow, itong parang arrow, yan yung blood kunwari. So, pag nag-flow ang pag nag-relax ang heart, mag-flow yung blood dito sa bicuspid valve. And then when the ventricle contracts when the ventricle contracts, mag-close itong bicuspid valve para ma-prevent yung pagbalik ng blood sa left atrium. So, ito yung tricuspid valve. This is the papillary muscle, the chordae tendineae. So, di ba sabi kanina, the chordae tendineae and the papillary muscle prevents the inversion of the tricuspid valve or the bicuspid valve. Kasi pag nag-contract ang heart, hindi na makakabalik ang So, itong papillary muscles and chordae tendineae, they prevent the inversion of the bicuspid valve, AV valves. So, ito yung posterior view ng heart natin. Ito yung bicuspid valve. So, this is the left atrium. This is the tricuspid valve, and so this is the right atrium. Ito yung aortic valve. Ito yung aortic valve. So, dito yung aorta. Dito yung pulmonary valve. This is the pulmonary trunk, pulmonary artery. So, ito yung aortic valve. So, ito yung aortic valve. Ito. So, what are the heart sounds? So, the heart sounds, you have two sounds per beat. The lub, dub. So, lub, dub, lub, dub, lub, dub. So, yun ang two sounds ng heart natin. So, heart sounds can be described as lub, dub. Lub, dub. Yan. The heart sounds are due to the vibrations that the valve movements produce. So, ang heart sounds natin is because of the vibrations of the valves. Yung sabi kanina, yung atri, the AV valves and the semilunar valves. So, the first part of the sound occurs as AV valves close. Etong lub, ang first sound ng heart natin is because of the AV valves when they close. Ang AV valve is this one. Diba? Ito. This is the AV valve, the tricuspid valve, and the mitral valve. So, pag nag-contract ang ventricles, ventricles, magka-close itong tricuspid valve, and then yung vibrations na na-produce ng valves na ito, that is the first sound. First sound ng heart. And then the second part naman, yung dub, is associated with the closing of pulmonary and aortic artery. So ito, 'di ba, yung pulmonary valve and the aortic valve. So when these valves closes, that is the second sound of the heart. Yun na yung dub. So, improper closing of a valve results in a heart murmur. Pag hindi masyadong proper yung pag-close ng heart, it will result to a murmur, which is a abnormal heart sound, itong murmur. So, ito. Where can you auscultate? How can you hear heart sound? Through auscultation with the use of stethoscope. So, ito. Saan mo maririnig yung aortic valve? Dito banda sa may second rib, gitna ng second and third rib. Saan mo maririnig yung tricuspid valve? Dito sa parang left 6 ribs sa gitna, and then itong bicuspid valve dito, and then itong pulmonary valve dito mo siya maririnig. We also have the coronary vessels. The right and left coronary arteries branch from the ascending aorta, and via their main branches, the anterior and posterior interventricular, the marginal and circumflex arteries supply the heart itself. So we have the right coronary artery from the dito sa branch siya ng aorta. Ito ang aorta, and then we have the right coronary artery, we have the left coronary artery. So our heart is also an organ, so it also needs oxygen. So what supplies oxygen sa heart natin? Ito yung coronary vessels. So venous blood collected by cardiac vein is emptied into the coronary sinus and drained into the right atrium. So since gumamit rin ng oxygenated blood ang heart natin, that venous blood or yung nagamit na blood or the oxygenated blood, i-collect ng cardiac vein. Wala dito yung cardiac vein, pero i-collect siya ng cardiac vein, baka ito, this one, itong mga maliliit na veins. So it will be collected by the cardiac vein. So ini-empty niya yung venous blood papuntang coronary sinus. Coronary sinus is a vein then nagbibigay ng or daanan ng the oxygenated blood papuntang right atrium. So we have the pathway of blood through the heart. So the right heart is the pulmonary circuit pump, and the left heart is the systemic circuit pump. Etong pulmonary circuit pump, dito yan nangyayari sa right heart, right part ng heart. Itong blue na color, yan yung pulmonary circuit pump. While the systemic circuit pump, itong red is yan ang systemic circuit pump dito banda sa left side ng heart. So what happens how does the blood passes through the heart? First, ang mangyayari is the pulmonary circuit pump. The oxygen poor systemic blood or oxygen poor or deoxygenated without oxygen na blood papasok sa right atrium. So ang deoxygenated blood, oxygen poor blood papasok sa right atrium by dito sa superior and inferior vena cava. So the deoxygenated blood will enter the right atrium by the superior and inferior vena cava. And then pag nag-relax ang heart, the oxygenated blood that was accumulated here in the right atrium will flow dito sa right ventricle by tricuspid valve. So the blood here that was accumulated will flow dito sa right ventricle. And then when the ventricle contracts, the blood that was here sa right ventricle will be pushed papuntang pulmonary trunk. And it will pass dito sa pulmonary valve to the pulmonary trunk and left and right pulmonary artery papuntang lungs, to the lungs. And then, pag na-oxygenate na yung blood dito sa lungs, it will go back to the heart by the left, to the left atrium na. So, oxygenated blood na siya. So, this starts the systemic circuit pump. So, magiging oxygenated blood na siya. Dito siya papasok sa pulmonary veins. The right pulmonary veins and the left pulmonary veins. Papunta dito sa left atrium. So, yun na. The oxygen-laden blood or the oxygen-rich blood or the oxygenated blood enters the left atrium. And then from the left atrium, pag nag-relax ang heart, mag-flow yung oxygenated blood papunta dito sa left ventricle. So, pag ang left ventricle nag-contract, yung blood mapupush or yung oxygenated blood mapupush siya dito sa aorta. And then sa aorta, i-distribute niya yung heart papunta sa other organs ng ng body natin that needs oxygen. Ito yung ascending aorta and we have the descending aorta. So the ascending aorta will distribute the blood sa upper parts ng body, and then the descending aorta will distribute the blood sa lower part ng body natin. So that is how the blood passes through the heart. So ito, the continuation. So which provide functional supply of all body organs. Yun na, sa aorta, the aorta will distribute the oxygen to all body organs natin. So, systemic veins return the oxygen-depleted blood to the right atrium. And then, ganon yung cycle na nangyayari. Pag na-distribute niya yung oxygenated blood all throughout the body, ang systemic vein, i-return niya yung oxygen-depleted or oxygen poor blood papunta dito sa right atrium by the superior and inferior vena cava, and then that is how yung cycle, ganon yung cycle na nangyayari. So the heart is a double pump. Yes, the heart is a double pump. The right side of the heart receives the oxygenated blood from the body and pumps it to the lungs. So yun yung a double pump. So double pump daw ang heart. So, itong right side ng heart, which consists of the superior vena cava, inferior vena cava, right ventricle and left ventricle, and pulmonary arteries. So, yung it will receive the oxygenated blood. Ayun, the oxygenated blood from the body papunta dito sa right ventricle, then ipopump niya papuntang lungs. And then, dito naman sa left side, the heart receives oxygenated blood from the lungs and pump it to the body. So, itong left side, pag bumalik dito yung oxygenated blood, it will pump it to the other parts of the body through the aorta. So, both sides of the heart works simultaneously. So, ito, we have the cardiac cycle, the sequence of events in one heartbeat. So, what happens in one heartbeat? Ano yung mga nangyayari? So, the cardiac cycle consists of systole. Systole is the contraction ng heart, and diastole, which is the relaxation, pagre-relax ng heart, of both atria, yung right and left atrium, and systole and diastole of both ventricles, and then yung pag-contract and relax din ng both ventricles. So, ito, we have the phases of cardiac cycle, yung atrial systole, ventricular systole, and the relaxation period. Ito. So first, we have the cardiac diastole of the relaxation period. So all chambers are relaxed and blood flows into the heart. So dito, ang first na mangyayari, when the heart relaxes, yung blood, deoxygenated pa yun siya, yung deoxygenated blood will flow into the heart dito sa right atrium. So yun, that is how the heart kailan nagfo-flow ang blood sa heart natin? Kapag nag-relax yung heart. And then, second is the atrial systole. It is when yung magko-contract yung atria natin, and then yung diastole naman ang magre-relax. So yung blood na na-accumulate dito sa right atrium and the left atrium will be pushed sa ventricles. So the blood that was accumulated here in the right ventricle, pag nag-contract ang atria, ang blood na na-accumulate dito sa right atrium, pag nag-contract ang atrium, mapupush yung blood dito sa right ventricle. The same thing goes here. So the left ventricle, the blood that was accumulated here in the left ventricle will be pushed dito sa left ventricle. The blood that was accumulated here in the left atrium will be pushed dito sa left ventricle. So that is the atrial diastole and ventricular diastole. Dito naman, atrial diastole and ventricular systole. So in here, yung atria naman ang magre-relax, and then the ventricles will be the one to contract. And then yung blood na nandito na sa ventricles, the left and right ventricles, pag nag-contract ang ventricles, the blood that was here will be pushed into the pulmonary veins, pulmonary artery, and dito naman is sa left ventricle, yung blood na nandito will be pushed papuntang aorta. And yung aorta naman, i-distribute niya yung oxygenated blood papuntang other parts or other organs of the body that needs oxygen. So ito, you have the cardiac conduction pathway. Ito yung pathway of impulses, yung mga impulses during the cardiac cycle. So again, this is the cardiac cycle. So ito yung mga impulses, what initiates the cardiac cycle. So we have the conduction system of the heart. Ito. So the conduction system of the heart consists of the SA and AV nodes, the AV bundle and bundle branches, and the Purkinje fibers. So this system coordinates the polarization of the heart and ensures that the heart beats as a unit. So itong conduction system, we have the SA nodes or sinoatrial nodes. Ito, this one. This is the SA node. We have the AV node. Ito, atrioventricular node. And we have the AV bundle. We have the AV bundle. Yes, we have the AV bundle. Ito, this is the AV bundle. And we have the bundle branches. Itong right bundle branch and dito left bundle branch. And then we have the Purkinje fibers. Ito. We have the Purkinje fibers. And that consists the conduction system. So their function is, so the SA node in the wall of the right atrium initiates each heartbeat. The cells of the SA node are more permeable to Na ions and depolarize more rapidly than any other part of the myocardium. So itong SA node, this one, is initiates each heartbeat. Siya yung nag-i-initiate ng each heartbeat. So, ang cells nitong SA nodes are more permeable to Na ions and depolarize more rapidly than any other part of the myocardium. So, depolarize. Yes. So, the cells of these sinoatrial nodes will depolarize. Itong arrow, magde-depolarize, and yung electric circuit, something, and papunta dito sa left atrium, and then papunta dito sa atrioventricular valve. So itong so the polarization of the heart is the orderly passage of electrical current. So itong passage of the electrical current. So first dito magsa-start sa sinoatrial nodes. Kasi siya yung mag-initiate ng heartbeat because yung cells ng SA nodes are more permeable sa sodium ions and they can depolarize more rapidly. And dito magsa-start yung depolarization sa sinoatrial node. And then it will reach the atrioventricular node. So the AV node is in the lower interatrial septum. So nandito siya sa lower interatrial septum. Ito yung nagse-separate sa left atrium and the right atrium. So the depolarization of the NA nodes, pag na-depolarize ang SA nodes, magsispread siya or darating siya sa AV node and the atrial myocardium and bring about atrial systole. So, where is that? So, pag yung depolarization nitong SA node, marireach niya itong ventricular node. Like this, and the myocardium, atrial myocardium, and then the atrial myocardium. And that will cause the atrial systole or yung pag-contract ng atrium. Ito, so nag-contract yung atrium. And then the AV bundle naman is in the upper interventricular septum, the first part of the ventricle to ventricles do depolarize. Ito yung bundle branches. Itong right bundle branch and the left bundle branch. Nandito siya sa interventricular septum. And then the right and left bundle branches in the interventricular septum the right and left bundle branches in the interventricular septum trans, it impulses the Purkinje fibers in the ventricular myocardium in which completes ventricular systole. So this is the Purkinje fiber. So itong bundle branches, the right and left bundle branches, will impulse to the Purkinje fibers. So magbibigay siya ng impulse dito sa Purkinje fibers, and then which completes the ventricular systole o yung pag-contract ng ventricles. That is the cardiac conduction pathway. So we also have the electrocardiogram or the ECG. The electrocardiogram records the electrical changes in the myocardium during a cardiac cycle. So an electrocardiogram, ito yung representation ng electrocardiogram. It is a graphic representation of the cardiac conduction cycle. 'Di ba? Ito yung cardiac conduction pathway, and then yung nangyayari dito is the cardiac conduction pathway. So itong electrocardiogram, it represents the cardiac conduction pathway. Itong P-wave, the P-wave reflects atrial depolarization. Ito yung reflect niya dito is when the atria depolarize. And then the QRS, itong QRS is when the ventricles depolarize. What happens when the atria depolarize? Magko-contract. It will bring about the atrial systole. And then what happens when the ventricle depolarizes? It will bring about the ventricular systole. The ventricles will contract. So ito yung duration ng pag-contract ng ventricles. And we have the T wave represents ventricular repolarization. So itong T wave, dito naman is yung pag-repolarize ng ventricle kasi na-depolarize siya, so it will become repolarized. So arrhythmias are irregular heartbeats. Their effects range from harmless to life-threatening. So arrhythmias, it is a disorder or irregular abnormal heartbeat. Pag it's either na abnormal yung heartbeat, an irregular heartbeat. So their effects range from harmless to life-threatening. We also heart rate. So a healthy adult has an average heart rate of 60 to 80 beats per minute. Ito yung normal heart rate ng isang adult. Children and infants have faster impulses because of their smaller size and higher metabolic rate. So the heartbeat or heart rate of a infant or a child is 120 to 160 beats per minute or BPM. Kasi mabilis yung pulse because maliit, smaller ang size ng heart nila, and they have higher metabolic rate. Dito naman sa adult, ang average heart rate natin is 60 to 80 beats per minute kasi malaki yung size ng heart natin, and medyo slower yung metabolic rate natin. So a person in good physical condition has a slow resting pulse because the heart is a more efficient pump and pumps more blood per beat. So how can we regulation of the heart rate? So we have the medulla. Medulla is part of the brain. It contains the cardiac centers. Dito sa medulla, we have the cardiac centers, which is the accelerator center and the inhibitory center. This is the medulla. So the accelerator center stimulates cardiac function by regulating heart rate and stroke volume via sympathetic stimulation of the cardiac accelerator nerve. Ito. So we have the sympathetic impulse to the heart. So itong accelerator center regulates the heart rate and stroke volume via the sympathetic impulse. So itong sympathetic impulse, yun na, increase rate and force of the contraction. And we also have the inhibitory center. The inhibitory center slows cardiac function by decreasing heart rate and stroke volume via parasympathetic stimulation from the vagus nerve. So itong inhibitory center, it slows down the heart rate. It slows down the heart rate and stroke volume via this parasympathetic impulse. So the accelerator center uses the sympathetic impulse to increase rate and force of contraction ng heart, while the inhibitory center uses the parasympathetic impulse to decrease heart rate and force of contraction. So heart is affected by hormones. So what affects our heart? We have hormones. We have the epinephrine from the adrenal medulla. So this hormone is from the adrenal medulla. So this increases heart rate. So this epinephrine increases heart rate and force of contraction during stressful situations. We also have ions, the sodium, potassium, and calcium. We have age. So ang pagbata, mabilis ang heart rate. Pag matanda na or adult na, konti or mahina or normal, mahina yung heart rate. And physical fitness, pag when you are exercising, mas mabilis yung heart rate mo. And body temperature as well. So we have the cardiac output. This is the cardiac output. The cardiac output is the amount of blood pumped by the left ventricle into the aorta. So ito yung gaano kadami yung blood na napapump ng left ventricle papuntang aorta or by the right ventricle papuntang pulmonary trunk in 1 minute. So we can calculate this cardiac output by this formula. Cardiac output is equal to stroke volume in ml over beat times the heart rate in beats per minute. So ito. So for example, in a typical resting adult male, stroke volume averages 70 ml per beat and heart rate is about 75 beats per minute. Thus, average cardiac output is, so what you are going to do is you are just going to multiply the stroke volume and the heart rate. Ang stroke volume niya is 70 ml per beat. Ayun, 70 ml per beat times the heart rate, which is 75 beats per minute. So it is equivalent to, if you multiply that, you will have 52.50 and thus 5.25 liter over minute. So the stroke volume is the amount of blood pumped by a ventricle in 1 beat. Average is 60 to 80 ml. The normal stroke volume is 60 to 80 ml. So dito, normal lang yung stroke volume niya, which is 70 ml per beat. So according to Frank Starling's law of the heart, the more cardiac muscle fibers are stretched, the more forcefully they contract. And during exercise, stroke volume increases as venous return increases and stretches the myocardium of the ventricles. So we have the disorders related to the heart. We have asystole, 'di ba? Ang systole is the contraction of the heart. Ang diastole is when the the systole, yun na yung contraction. And then the diastole is the relaxation. We also have a systole. A systole situation in which the heart fails to contract. Pag sa mga drama, pag nakikita mo yung electrocardiogram, parang may linya and then may sounds na ting. That is the asystole. The heart fails to contract. So, hindi na nagko-contract ang heart. And ibig sabihin nun, patay na yung tao. So, ito yung mga disorders related sa heart. We have the cardiac catheterization, diagnostic procedure involving passage of fine catheter tubing through a blood vessel into the heart. So, malalagyan ng catheter ang ang blood vessels natin papunta sa heart. So, blood samples are withdrawn, kukuha ng blood samples, and allowing oxygen content, blood flow, and pressure within the heart to be measured. So, this will measure yung oxygen content, yung blood flow, at yung pressure within the heart i-measure. So, findings help to detect valve problems, heart deformities, and other heart malfunctions. So, this cardiac catheterization will help detect valve problems. Yun na yung sa AV valves and SA valves. Yun, it will help detect different valve problems. Yung heart, if there is a deformity in the heart and other heart malfunction. We have the commotio cordis, concussion of the heart. So, situation in which a relatively mild blow to the chest, parang suntok or mild blow sa chest natin causes heart failure and sudden death because it occurs during a vulnerable interval when the heart is repolarizing. So, pag nagre-repolarize, kasi di ba madedepolarize ang heart. So, when the heart is repolarizing tapos may mild blow sa chest, it will cause a heart failure or sudden death. So, this explains why there are rare instances when youngsters drop dead, namamatay on playing field after being hit in the chest by a wall. We have the endocarditis or endocarditis. It is the inflammation of the endocardium. Diba ang endocardium, it is the inner wall, the middle wall of the heart. So, the inner wall, yes, the inner wall of the heart. So, it is usually confined to the endocardium of the heart valves. So, ito, endocardium dito. Endocardium ng heart valves natin. Endocarditis often results from infection. So, pag ditis kasi or ditis, inflammation yan. And, by bacteria that have entered the bloodstream but may result from fungal infection or an immune response. So, drug addicts may develop an endocarditis by injecting themselves with palpitation, a heartbeat that is unusually strong, fast, or irregular so that the heart or with contaminated needles. Itong palpitation, yun na yung pag strong and unusual, strong, fast, or irregular heartbeat. Lalo na pag another example pag nagpalpitate ang heart is when you yung intake ng coffee. So ito, endocarditis is the inflammation of the endocardium. As you can see, parang may mga bacteria. So may infection na nangyari sa endocardium ng heart natin. This may be because of bacteria na naka-enter sa bloodstream, and then 'di ba yung blood is papasok dito or papasok dito sa heart natin. So those bacteria might stay dito sa endocardium and will result to endocarditis. We also have the heart palpitation. Yun na. Strong, fast, irregular heartbeat. Ito, the heartbeat that is unusually strong, fast, or irregular so that the person becomes aware of it. May be caused by certain drugs. So ito, parang mabilis masyado at very strong yung heart. Mabilis, very strong at irregular yung heartbeat. So, yun ang heart palpitation. It can be caused by certain drugs. Emotional pressure or nervous heart, di ba pag nervous or nervyos ka, nagpapalpitate ka. As well as pag may mga heart disorders at saka pag uminom ka ng coffee or madaming coffee. We have the hypertrophic cardiomyopathy or HCM, the leading cause of sudden death in young condition. Itong HCM, it is usually genetic, inherited, causes the cardiac muscle. Ito, the cardiac muscle. This causes the cardiac muscle, parang itong myocardium, to enlarge, thickening. So, lalaki itong cardiac muscle, itong myocardium, this is the myocardium. So, it will enlarge, thick, lalaki siya. So, the heart pumps strongly but doesn't relax well during diastole when heart is filling. So, pag nag-heart, yung heart natin nagpa-pump strong pero hindi masyadong nakaka-relax because of this swell in the cardiac muscle. We also have the mitral valve prolapse. So, valve disorder affecting up to 1% of the population, most often seen in young women. So, it appears to have a genetic basis resulting in abnormal chordae tendineae or malfunction of the papillary muscle. Diba, sabi kanina, ang chordae tendineae and the papillary muscles helps prevent inversion of the left AV or the bicuspid valve. So this is a disorder in the bicuspid valve, the mitral valve prolapse. One or more of the flaps of the mitral valve becomes incompetent and below into the left atrium during ventricular systole, allowing blood regurgitation. Occasionally requires valve replacement surgery. Di ba kanina, ang ano niya is to prevent backflow. So, since one or more of the flaps of the mitral valve becomes incompetent, and then magkakaroon ng backflow, and that is already a problem and abnormal. So, that is the mitral valve prolapse. Nag-prolapse yung mitral valve which allows the backflow of heart papuntang left atrium. This is usually often seen in young women, pero 1% lang ng population. Parang genetic rin siya. We also have the myocarditis, myo, muscle, card, heart, itis is inflammation. Yon, basta itis, inflammation talaga yan. So, inflammation of the cardiac muscle layer or the myocardium of the heart. Diba dito sa isa is the cardiac muscle, itong myocardium thickens. That is the hypertrophic cardiomyopathy. Dito sa myocarditis, there is an inflammation sa myocardium. Sometimes follows on an untreated streptococcal infection in children. So, this streptococcal infection, streptococcal infection, pwede yung streptococcal pneumoniae, pwedeng yun ang cause, yung streptococcal infection sa children causes myocarditis. So, this inflammation will weaken the heart and impair its ability to effectively pump. So, pag there is an inflammation sa heart muscle, it will weaken the heart and then the heart will lose its ability to pump effectively. And that is a disorder or that is a problem. We have the ventricular tachycardia. Tachycardia is rapid ventricular contraction that are not coordinated with atrial activity. Etong tachycardia yung tachycardia yung faster heartbeat, faster than normal heartbeat. So this is in the ventricles naman. So there is rapid ventricular contraction. So hindi coordinate yung contraction ng atria sa ventricles. So we have the cardiac arrest is a clinical term meaning cessation of effective heart rate. Masyadong self-explanatory naman itong cardiac arrest. And then we have the cardiomegaly is heart enlargement. As you can see in the picture, enlarge yung heart niya. That is cardiomegaly. And that is all. Thank you.